Hello and welcome to Southwestern's 2020 Benefits Open Enrollment webinar. My name is Amy Kirby. I am with Gallagher Benefits and I will be walking you through your options for this new plan year beginning January 1st, 2021 and lasting through December 31st, 2021. My goal is to make sure that you have a general knowledge of how your plan works. We ask that you please review this information carefully along with the information provided by your HR team and your employee benefits guide. During the presentation, we are going to be covering a variety of topics. We're going to start with talking about your open enrollment timeline, and then we'll go through each of the benefits that are offered to Southwestern employees and talk about any changes coming up for medical, dental, vision, flexible spending accounts, and health savings accounts. Let's start with your open enrollment timeline. Your open enrollment period will run from November 11th to November 17th. Any changes that you make during this time will be effective for the new plan year of January 1 to December 31. Open enrollment applies to medical, dental, vision, and flexible spending accounts. Please note that open enrollment is the only time during the year that you can make changes to your benefit plans without the occurrence of a qualifying event. If you experience a qualifying life event throughout the plan year, you are allowed to make changes to your benefits plans as long as you notify Southwestern and make those changes within 30 days of the qualifying event. Some examples of qualifying events include marriage, divorce, or legal separation, gain or loss of an eligible dependent, changes in employment to you or your spouse's open enrollment period. This slide is going to show you each line of coverage that's offered through Southwestern and who the carrier is going to be for 2021. As you can see, your medical and virtual visit coverage will continue to be offered through Blue Cross Blue Shield and MD Live. There will be a carrier change for the dental plan, so what was previously Guardian will now be administered through MetLife. Vision will continue with VSP. Your FSA and HSA will continue through Discovery. And your professional health services are going to be administered through Allight, who is previously Compass. Southwestern offers you 3 medical plans, 1 high deductible health plan, and 2 PPO plans. All of these plans utilize the National Blue Cross Blue Shield network for in and out of network benefits, and both cover your preventive services at 100%. In the high deductible health plan, all of your services are going to count towards the deductible. You will have the opportunity to participate in a health savings account and take advantage of a lower monthly premium. For the PPO plans, they offer you copays for office visits and prescriptions. They feature a lower deductible with a higher monthly premium. This slide gives you an overview of the 3 medical plans offered by Southwestern. Great news is that there are no changes from last year. So if you are currently enrolled in one of these plans, you will not see any changes for 2021. If you go across the screen, you can compare each one of these plans to each other. For example, you can see that the deductible for the high deductible health plan is $3,000 for an individual, $1,500 for an individual on the base plan, and $750 for the buy-up plan. This chart is also located in the benefits guide that was distributed from your HR team. We know that sometimes it can be confusing on which medical plan to choose, so here's some tips along the way. Consider how you use your plan, including your preventive care and prescription drugs. Consider your cost to be on the plan, so look at your monthly premiums. Consider any coverage that your spouse may have available through his or her employer, and also look at what's important to you in a medical plan. Is it preventive care? Do you prefer physician and drug copays, or do you like more of a deductible and co-insurance plan? What does the catastrophic coverage look like? And what plans give you the opportunity to participate in a health savings account? We wanted to take this time to go over a couple of examples of how the health plan would have worked in different scenarios so that you can see how much the member would have paid out of pocket. In this example, Sean needs to have a knee surgery. He sees his medical provider once for a diagnosis and then has his surgery. Following surgery, he has 10 physical therapy visits and takes some pain medication. Sean has employee-only coverage and all services were rendered by in-network providers. As you can see, on the high deductible health plan, Sean would have had to pay for all of his services until he met his deductible. Once he met the deductible, he then went into the coinsurance portion where he was responsible for 20%. In this example, Sean's total out-of-pocket, which includes the annual premium and the annual HSA contribution, would have been $4,100. In the next two plans, the base and the buy-up plan, Sean would have had to pay co-pays for his office visits, hospital admissions, and then once he met his deductible, then he would have been responsible for 30% co-insurance. So on the base plan, when you consider the annual premiums out of pocket, Sean would have paid $6,020, and on the buy-up plan, Sean would have paid $5,086. In the next example, Sarah is a healthy 35-year-old with minimal medical expenses. She sees her medical provider once for a routine physical and then again reaches out to MD Live for a sinus infection. Two medications were prescribed for the sinus infection. Sarah also takes a monthly medication for allergies. Sarah has employee-only coverage and all services were rendered by in-network providers. If Sarah were enrolled in the high deductible health plan, her preventive services would have been covered at 100%, so her routine physical. She would have had to pay the cost of her allergy medication until she met her deductible. She would have paid the cost of the virtual visit fee until she met her deductible. And she would have also paid for her sinus medication until she met the deductible. In this example for the high deductible health plan, after taking into account Southwestern's HSA contribution, Sarah would have paid $94. If Sarah was enrolled in the base or the buy-up plan, her preventive services still would have been covered at 100%, and she would have had co-pays for her prescriptions and virtual visits. In the example that we provided, Sarah would have paid $1,480 for the base plan and $2,236 for the buy-up plan. This slide, which also can be found in your benefits guide, will give you a breakdown of the semi-monthly, monthly, and 9-month rates for each of the medical plans. Virtual visits allow you to see a doctor anytime, anywhere. You can access virtual visits via phone, online video, or on your mobile app. The average wait time is less than 20 minutes, and doctors can send in e-prescriptions to your local pharmacy if needed. Typical visits include allergies, asthma, cold and flu, rashes, pink eye, and much more. You can access virtual visits by calling MD Live, going to the MD Live link on the Blue Cross Blue Shield website, texting Blue Cross to 235-483, or downloading the MD Live app. If you enroll in the high deductible health plan, you may be eligible to participate in a health savings account. An HSA allows participants the opportunity to pay for qualified medical expenses with tax-free dollars from their HSA. There is no use it or lose it requirement, and the account is portable, so you can take this with you if you leave employment. In order to be eligible to participate in an HSA, you must be enrolled in Southwestern's high deductible health plan. You cannot be covered by another non-qualified medical plan. You cannot be covered by Medicare or TRICARE. You cannot be participating in a medical FSA unless it's a limited use FSA. And your spouse cannot be participating in a medical FSA unless it's a limited use FSA. Eligible expenses are defined by the IRS code 213D. Please visit that website in order to see a list of all covered HSA eligible expenses. HSAs provide you with several different tax advantages. Your money goes into the HSA tax-free. In addition, it can earn interest tax-free. Also, if you distribute that money to pay for qualified medical expenses, that money is also not taxed. In 2021, individuals can contribute up to $3,600 into an HSA, and families can contribute $7,200 into the HSA. If you enroll in this account, Southwestern will also contribute on your behalf. If you have employee-only coverage, they will contribute $100 per month or $1,200 per year. And if you have family coverage, they will contribute $200 per month or $2,400 per year. Please make sure whenever you are electing your annual amount that you take into consideration what Southwestern is contributing. An HSA also provides you a vehicle for saving money into retirement. It acts similar to a 401k, but with the ability to access the money for healthcare expenses. You have the ability to invest in mutual funds to grow this account, and your earnings are not taxed. Please keep in mind that once you enroll in Medicare, you can no longer contribute to an HSA, but you can spend the money on your out-of-pocket medical expenses and never be taxed on it. You may roll over a contribution from your traditional or Roth IRA one time during your lifetime to pre-fund the account. We ask that you please see your tax advisor for advice on how to integrate an HSA into your retirement planning. Southwestern also gives you the opportunity to participate in two different types of flexible spending accounts. The healthcare spending account allows you to set aside pre-tax contributions to use for out-of-pocket medical, dental, or vision expenses. The maximum you can contribute for the year is $2,750. Please remember that you cannot be enrolled in a high deductible health plan in order to be eligible for this account. The Dependent Care Flexible Spending Account allows you to set aside pre-tax contributions to reimburse yourself for work-related childcare for your children under the age of 13. This account allows you to contribute up to $5,000 per year per family. You can enroll in the high deductible health plan or the PPO plan and still take advantage of the Dependent Care FSA. There will be a 2.5-month grace period available on the Healthcare FSA. If money is not spent by the end of that grace period, it is use it or lose it, so you will lose access to those funds. So please be sure to keep that in mind when selecting your annual contribution. If you enroll in these benefits, you will be issued a debit card through Discovery that you will use in order to pay for those expenses. Previously known as Compass, Alight will continue to offer you spending and review services. Same company, different name. Some of the services that Alight can provide to you include understanding your benefits, finding great doctors, comparing prices and finding ways to save money on your healthcare, helping you get recommendations for lower cost medications, resolving any billing errors you may have. They can even help you schedule an appointment. Please utilize the contact information on this slide and in your benefit guide to take advantage of services offered through Alight. Southwestern will continue to offer you 3 dental plans to choose from. You'll have a DHMO option and then 2 standard PPO options to choose from. If you elect to enroll in the DHMO, you will need to select a primary dentist. Services will only be covered in network. Referrals are required. This plan does have a lower premium. If you choose to enroll in one of the 2 standard PPO dental plans, there is no primary dentist requirement. You will have a low option and a high option, which we will review on the next slide. Here are your 3 dental options, which can also be found in your employee benefit guide. For the 2 standard PPO plans, you have a low plan and a high plan. Each plan will have a $50 deductible per person, $150 per family. On the low plan, your benefit maximum each year is $1,500. Your preventive services are covered at 100%. Basic services are covered at 100%. Major services are covered at 60%. Orthodontia is covered at 50% up to $1,000 lifetime max. On the high plan, you will continue to have that same deductible, but your benefit maximum each year is increased to $1,750. Preventive services are still covered at 100%, basic are covered at 80%, and major is covered at 50%. Orthodontia will continue to be covered at 50% up to $1,000. The DHMO will work the same as it does now, where you have no deductible or benefit maximum. You will have a $5 copay per office visit. Then you will need to refer to the patient charge list for a full listing of the member costs for services performed. This is posted online. Your vision plan will continue to be administered by VSP. If you visit a network vision provider, you will pay a $20 copay for exams and a $20 copay for materials, including lenses and contacts. The plan has a $130 allowance for frames and contacts. Standard lenses such as single, bifocal, and trifocal are covered at 100% after your $20 copay. Lens add-ons such as tint and scratch-resistant coatings are available for an additional cost. Progressive lenses are also available for an additional cost. The plan covers one exam every 12 months, contact lenses every 12 months, and frames every 24 months. If you visit an out-of-network vision provider, you will have to pay for the cost of services up front and submit a claim form for reimbursement. We always encourage you to use in-network providers if possible. Please check your benefit summary for full details. This concludes the presentation for open enrollment. Thank you so much for your time, and if you have any additional questions, please refer to your benefits employee guide or contact your HR department. Thank you and have a great day.